Hello friends, good evening. Uh, Today we are going to discuss about the NEET PG 2023 exam for the this is the third video in series. First one I posted about the inflammation and wound repairing. Second I posted about the respiration, and third about today now first part of the GIT. GIT is a very important topic, so I will post the another video also in a couple of days. This video first part, as I mentioned, that your pattern of the examination has been changed. The question asked are integrated questions, so it is imperative that you must learn also in the way in which the examination questions are asking. So again I am repeating, whenever you are studying, you are I think you people are already started the preparation for the NEET PG 2023, which is going to happen on 23rd of January. So for that, what needed is, if you are studying medicine, any subject you are studying, then in that topic give 2 or 3 hours in a day, so that you will be freshen up also, and look for the integrations, how this topic is integrated to the various subjects. For example, if you are studying uh, cardiovascular medicine, and the if you are studying cardiovascular chapter in the medicine, then study it as per your pace in the day, 2 3 4 5 days. But on the in because if you are studying continuously the same thing, then what happens is all things mixed up, and our retention power is also compromised, because at the end of the day, if we exhaust from the topic, then we will not able to retain whatever we studied, and that is very costly for us in the examination. As you have seen this year examination, that scoring was not up to the mark, or not up to the expectation. People were expecting more marks, but they get less marks, and particularly for those who are in service, because they don't have the time to study in this way. So this is a very critical thing. So this is my effort to make you understand about the integrated concept, so that it will be easy for you to understand the subject and study in a way. So in this part of video, what we'll do is, today I'll discuss about the gastrointestinal tract part 1, because it's so important and it's so vast subject that you will find uh, at least for 20 to 25 questions around this topic. So it's so important. So 10% question if comes from a one topic, then it's a very important. And these 20 25 questions you won't find singly from medicine. You will surgery included in this, pediatrics included in this, you will find microbiology in this, you will find anatomy in this, you will find biochemistry in this, you will find the physiology in this. So and but when the question post examinations, your all the coachings or the all the tutors, what's they are claiming, this question is from medicine, this question is from surgery. And if you start totaling those questions, then those questions number will shoot up beyond 200. So this is the reason, that's why this is the reason that you must study, and you must give focus on this integration part also. So this is very essential, that you study in a way that in your pace, but give at least 2 to 3 hours in a day to study in integrated way. So this is an effort, and now let's start with the this GIT part 1. So what today I have uploaded the questions. First part of the question, these are, we called it pre-test. So you go through these pre-test questions first and try to answer those questions. Don't hesitate or don't afraid that this question is very lengthy or your questions you don't know about the question. Attempt it, note down the answer, then go through the presentation and look if it is covered or not covered, whether you attempted right or wrong. So it will give you the boost. So today the question as well as the first part of the GIT presentation is uploaded, and this is an extensive presentation, encompasses anatomy, physiology, part of biochemistry I'll cover in the part 2 also, a part of microbiology, pathology. Microbiology is not covered so much, but it will covered in the more in the part 2, surgery, internal medicine. So these parts I try to cover in the presentation. And again, I'm telling you, this is not an extensive or detailed one. This is broader outline. It will help you help you to go and read more about the topic, so that you will learn more and you will learn more precisely, so that chances of getting wrong in the examination will be minimized. So this is my aim of this presentation, so that you become more hungry to learn more, because I have given the broad outline. Maybe then what happens is you think, okay, I have missed this point, I have missed that. Yes, this is my aim. You try to get the point where I missed that one, so that you can study by yourself. When you will study by yourself those points, my experience is you won't forget those things in examination also. If anything comes, then the question probability of getting right will be near to 100%, will be near to 100%. So by this way you can increase your performance in the examination. So let's begin with the uh, I think pre-test first. I'm not very good in the IT, that's why this is the problem. Why this is not showing it, I don't know. So you can download it from here, and you can go through with these questions. So these questions are definitely helpful for you. This is a series of part 1 questions, and uh, I'm trying to get this on the screen so that it can be. Okay. So this is the presentation which uh, start with this. So let me have this one. So uh, please bear with me. Sorry that this is not coming up. Okay, where it is? Where is the keynote? Keynote. Oh my god. Okay, now you can see these questions at last. Uh, Whatever you are asking about the rank, please refer to my last videos. Now this is question about the CT scan image. You can see that, and then you have to identify the anatomical structures. So you can see that in question ask about the only one structure, but this question can be asked in examination because there are five options, and they may give this question in a way that they will give you one is this, two is this, three is this, four is this, five is this. So which is the rightly marked. So you can ask about this question. And again, if you go for the next question, then uh, this is also a very important question. Uh, this is a lesion which you can see on the patients. So you will find this type of questions. And then during a direct inguinal hernia repair, so inguinal hernia repair, what you will find. So this is anatomical as well as surgery question is there. Uh, then question about anatomical positions again. Then a question, integrated question of anatomy and surgery. Then anatomy, physiology. So physiology with medicine. So all kind of these type of integrated question you will find, and you have to answer these questions. And remember, these questions, many of these questions can be tricked into the different question. For example, if you go to the look into the question number 20, then question number 20, they can give you the right option combination, and they are asking about this type of question. Basically, they are asking in the INI-CT examination. Similarly, if you go for a another diagram question, if I remember, I put it or not, because that's a very important and supposed to become. This is a graph question, so you must know about this one. This is a tricky question again. So yeah, this one. Question number 43. Question number 43, you can see that this questions asking about a particular drug, but to more to give to make you more think, they can give you in the similar diagram two or three drug combination and mark it A, B, C, D at some receptors point, because this is the gastric cell. So which drug is acting at which receptor site? So everything is included in the one diagram. So when you will find the answer, then definitely it will be easy for you to remember. So this will give you the more thirst about this one. Now this comes to pediatrics. This is very common questions. These are the very. This is also again a common question in old age. So because you know these are the important things which are asking in the pediatrics or the adult questions one. Uh, Image based question again. This is very confusing question, but you have to give the answer, and you will think what could be. Again, image based question, radiological image. So these questions are very important, and they can uh, they can ask the different questions from uh, this way. So this is the way by which they will ask the question on question about this one. So if if you go for the presentation, then presentation is also, I have provided the link in the description box. You can download it from there and go through this presentation as I mentioned you, so that it will be easy for you to go through this presentation. This presentation is talk about case present. This presentation again start with some question. A 3-year-old male with 1 to 2 days of right-sided abdominal pain, maroon colored stool, no fever, dysuria, rash, no recent travel. Physical examination is also given. So, and the blood findings are given. Hematocrit is positive. So, what it could be? So, again, you see this. They may ask you what next. So, what next is this Meckel's scan or technetium 99 scan, CT scan. So they can ask what next. They can give you this image. What is this investigation in newborn? Similar, same diagram. They can ask about this question. So so this they may give this one for you. Uh, so this is to diagnose the Meckel's diverticulum. So as we all know, this uh, Meckel's diverticulum is an developmental anomaly, and it is present is approximately 2% population. So here comes the development of uh, development of the gastrointestinal tract or normal embryology. So I have summarize the entire development of gastrointestinal tract in a slide from week 1 to week 20. What happened, uh, which which part formed in which week, so you can easily remember. And this is the concise embryology of the gastrointestinal development. uh, Now comes to the when development takes place, there must be some anomalies can take place. As we started with the Meckel's diverticulum, which is more common, like tracheoesophageal junction fistula, because the development of that part is from one portion. So it is chances are there that this may develop as an anatomical anomaly over there. Then in foregut, in midgut, in hindgut. Then when the part develop, the blood vessels also start developing along with it. And in anatomy, you have to remember about every portion's blood supply. So what I try to find and did is that I compile this blood supply in a single slide, so that this image, you have to memorize this image, and that will help you to give the answer if they ask direct question about the blood supply. And as you have seen that this is the sketch diagram, so it is easy to memorize, easy to visualize. Then comes to the histology. In histology part, uh, if normal stomach slide, if you are seeing like this, then there are some cell lines which secretes what the gastric juice contains, acid secretion. It also mucus secrete, bicarbonate secrete, and it also secretes hormone, which are not acting on the stomach, but they are acting on the different other part of the intestine. So from which cells the hormone secretes, from where the hormone secretes. So if you download the presentation, then you will find some on in some slides there are some notes on the down side of the presentation, so that you can go through these notes also, because these are the important things which I mentioned on these things. So if you study like this, and then you think about the question, then a term male infant, this question is given. So without seeing the answer in the notes section, you have to answer this question, because you have studied the embryology. Another question, and you have to answer these questions. So now your gastrointestinal tract is developed. So what is the function of gastrointestinal tract? So this is also again concise into one slide. So this is concise into one slide, and this is function of different part mentioned in one slide. So this is very helpful for you. Then carbohydrate digestion, where it takes place, which enzymes are responsible, and what is Bruce border enzyme, what is pancreatic amylase, salivary amylase. So Bruce border enzymes are LMS, lactose, maltose, and sucrose. These are called the Brush border enzyme. Brush border enzyme. So because they are at the fag end, they are acting on the last part of the digestion. Then protein digestion, fat digestion, absorption, in which part what absorb. So this is again in a diagrammatic way, so it is easy to remember because visualization is more easy to remember. Now then comes to the disorders. Disorders are also I try to concise in once or in these following slides, so that it will be easy for you. Okay, this type of disorder we may find in the GIT system. Then what are the clinical manifestation? So GITs, if these are the symptoms, then these are likelihood to be GI dysfunction: vomiting, dyspepsia, constipation, diarrhea, abdominal pain, GI bleeding. So vomiting, direct, indirect, what are the causes, where the center lies, dyspepsia, then diarrhea, then clinical manifestation of diarrhea, and at what portion, how much of liquid typical daily input is there. So total 10 liter liquids secrete and absorption, where and how, this is concise in one slide. Then again diarrhea, because diarrhea is very important. That's why you will find something of infectious natures, infectious agent in part 2, when I'll post those presentation. Then constipation, then GI bleeding, malabsorption syndrome, then specific esophagus, stomach, and intestinal system, dysphagia, achalasia, then reflux disease. Reflux disease is important. They may ask about this study also, GERD disease study. So this is a very important thing, very important graph. Uh, they ask in the examination. Then disorder GIT peptic ulcer, how it look like, directly visually look like under microscope. So these are the things which they can ask about direct imaging based questions. Then two type of peptic ulcer: gastric ulcer, duodenal ulcer. Their comparison compared into one slide in a table, so that it will easy for you to differentiate, to remember the differential diagnosis. So peptic ulcer, gastroduodenal barrier, so then appendicitis, then inflammatory bowel disease, Crohn's disease, ulcerative colitis and their comparative, then abdominal emergencies. This is more common in surgery, as well as in medicine also, traumatic and non-traumatic. So mostly the inflammatory associated or injury associated. Then ileus, Paralytic ileus is very important in the old age group. Mechanical ileus, different type, um, of which can cause the ileus and obstruction. Then intestinal obstruction, herniation, adhesions, volvulus, intussusceptions. Then then a normal KUB or normal abdominal X-ray. How to look into the X-ray and where to look. You will find the and these organs. You must have studied in your MBBS, but this is just to refresh you. So this is gas pattern X-rays. These are the calcification in the right upper near right upper quadrant. This is a large gallstone, kidney stone, bladder stone, or arteriosclerosis. So you have, if you see this image, then you have to identify. Then this may give you a false impression of a lump, because then radiologist roles comes. Then institutional colon, which is very common in the old age. Person who is lying more than this type of colon picture you will find. So they can ask you the uh, diagnosis of this one. Then gas under diaphragm. So this is rupture case. This was asked in this year question also. Then ascites X-ray, ileus X-ray, again ileus X-ray, and foreign body X-rays also they ask about this one. So this is all about the GIT part 1 questions and presentation. My request is go through with this presentation and questions, so that you will be benefited from this, because this is prepared by keeping in the mind that your paper is integrated one. So integrated questions they are asking you, and I am trying my best to give you an introduction, give you a sense that how the integration works and how the question frames in the integration. So when I'll do the second part, I'll post more questions, 60 more questions. Then part 2 presentation also comprises of microbiological agents for the gastrointestinal tract. Surgery part will be covered in the part 2 also, different type of procedures in that one, because that's also very important. Hepatology I'll cover in that one, and pancreatic disorders also will be covered in the part 2 of the gastrointestinal tract. So this is very important. Minimum 20 but maximum 35 questions you will see in the examination from this presentation. These two presentation, you will find minimum 20, maximum 35 questions. Maybe that language is different, but the integration pattern will be the same, so that it will be easy for you to attend those questions. Now you have asked about a question. 23rd January is the Monday. I know this is that day is the Monday, but that day is finalized by the NBE board. They have finalized. They proposed this date on the file. Now what it ball in the court of MOHFW. So MOHFW, which date they will approve, you will get to know. Tomorrow Monday, so I'll contact in there, and I'll try to find out whether 23rd is finalized, or 22nd is finalized, or 21st is finalized. So whatever date is finalized, I'll let you know before either in my next presentation or before that also. So this is all about the GIT part 1. So please read it, and I'll look into the comments and see what are the comments which I have seen, get it from in presentation. So what happens is in Jammu Kashmir, Jammu and Kashmir, the counseling will usually state state counseling in which nobody can participate, um, and the all India quota counseling will also applicable for you. So there is the same counseling pattern will not change. Notification probably this, because it's supposed to come in this week, but if it is not in this week, then definitely it will come 100. I'm sure that by the end of this week we will find the notification for the next year pre PG examination. And Asutosh, DNB medicine or not, radiology for BJ medical, um, and so can I get MD medicine? So for those, my suggestion is please go through the my previous videos, two different videos, one for the post graduation thing and another for the DNB, where you will find where you will find the my projections based on the last year cutoff and this year increment of seats which have been proposed already and already proposed, and part of it approved. Approval process is going on. So that is there, and so that's based on that DNB and PG cutoff is mentioned, and I have mentioned also in last time also that post round one you will find deviation of 12 to 15% in the second and third round projection which I have given to you. Reason also explained in my last video. So thank you very much, and I will, when I'll do the diploma presentation, uh, Dr. Panigrahi, when I'll do the diploma video, I'll share the corrected this postgraduate cutoffs. Uh, so you will find that time also. So this is all about the today's. Uh, So next examination, what the next? Next is PG, postgraduate examination first, then mid of the year, post mid of the year, second half of the year, you will get the next examination by the name of next examination. Next examination will be for the PG 2024. So in 2024, PG examination will be conducted along with the next. So students who are studying in the final MBBS this year, their final MBBS paper will be taken by the central agency. So all India similar paper, they have to sit in that examination, they have to clear that examination. Those who clear more than 40% will be go through the internship, and those who will score more than 50% will be eligible for the post graduation course. So accordingly, that score will be taken in the counseling of the post graduation admission for the 2024, and before the admission they have to go through the next level 2 which will be conducted by the respective universities. That will be a practical examination for the final MBBS subjects: medicine, surgery, pediatrics, gynecology, so orthopedics. So that final examination will take place in the next level 2, and next examination will take place twice in a year. So that you will first examination, final MBBS examination as a mm, post graduation entrance examination, and the score in the next can be kept up for 3 years. So if you sit in the next year next, and your score is less, then you can use the previous year next score. So that's the that is under consideration. That is not finalized, but this is already this is the proposal, not approved yet by the board. So whenever it will approved, we will come to know. So thank you very much, and counseling will start in the month of August, not before August. So goodbye. Have a nice evening, Sunday evening, and I'm sorry that I have disturbed your evening, but I think it is useful disturbance. Thank you.